this might be one of their first professional jobs coming out of high school and they're young and don't have that experience. And so, we found that giving TeamSTEPPS during our new employee orientation process, just kind of a snippet of it. You're going to hear these words. Just know that you're going to hear these on the floor with great situational awareness, great task assistance. We're going to have a shared mental model, all the buzzwords, in TeamSTEPPS, and letting the new team members know that they're going to hear that.
Welcome to Culture Change RX, the podcast for healthcare professionals that are committed to creating a thriving workplace culture, improving the experiences of employees and patients, and ultimately unlocking their organization's next level of potential. I'm Sue Tetzloff, your host and co-founder of Capstone Leadership Solutions. Join me and my insightful guests each week as we share actionable insights for navigating the crucial people side of the business of healthcare. Subscribe now for a weekly dose of Culture Change RX. Now let's dive into this week's conversation where culture change takes center stage. Welcome to another episode of Culture Change RX, the podcast that's all about the people side of healthcare. And today I have one of the amazing people that I know out there in the world of healthcare, Julia Green, and she's with us in the studio today. And we're going to be talking about recruitment and retention of medical assistants. So, Julia, let's start by having you introduce yourself.
Hi, thank you, Sue. So I'm, as you said, Julia Green. I work at Access Community Health Center in Madison, Wisconsin. My role now is the Director of Clinical Services for our medical operations. We have both medical and dental, and I oversee medical operations with our Chief Strategy Officer and Chief Medical Officer. For anybody that doesn't know, Access Community Health Center is a nonprofit in Madison, Wisconsin. We are a federally qualified healthcare center and really focus on improving, the lives and health of individuals in our community that face many barriers to health, whether it's financial barriers, insurance barriers, some, language and health literacy, cultural, and just wanting to connect them with the healthcare that everybody should be granted to. So it's a fun place to work, and everybody's here for our mission and our culture. And we have a very diverse work group as well, trying to mirror our patient population. And it's a joy. And we all learn from each other every day and get through all the obstacles and barriers that we face.
And what's amazing at Capstone, we've known about your organization for several years now. We've worked alongside of you as you stood up an initiative that you call your Mission and Excellence Initiative. And it's been wonderful to watch you engage your employees and, elevate and strengthen your leaders to be able to fulfill this mission that's often, like you said, daily, very challenging and year after year challenging to do. So your role, certainly, being the head of operations for something so important to your community, I'm sure it does come with some challenges. And that is what we wanted to talk about today, is that one challenge in particular about medical assistant staffing. And it's such a crucial role in clinic settings. Tell us what the challenge has been there, and maybe we can then get into talking about some of the creative things and the successes you're having to overcome that very specific challenge.
So a few years ago, I was working with my colleague that's also oversees kind of medical and has moved into more of a consulting role here with Access. But we were looking at our staffing and looking at, our provider schedules and the patients we need to see, and knowing that if our patients can't get in with us, they might get a $6,000 emergency room bill, and wanting to make sure that we're able to meet the needs of our patients while still having a sustainable workforce with our current support staff, who are the certified medical assistants and also licensed practical nurses, make up our support staff that do the rooming for our providers and take care of our patients and give the vaccines and do the EKGs and just everything that the patients might need while they're in our clinic. We were in critical staffing, I would say to the tune that, finance is like, knock, knock, guys, you're saving us too much money in medical. You're not spending enough on salaries. What are you okay?
How many times have we heard that in our career? None.
if finance starts getting worried and knocking on your door, something's going on. And it was, we had the pandemic and COVID, and it just turned our lives upside down. Many people left previously loved, career choices and switched career pathways, et cetera. And so we had to look at what we could do to, one, keep the amazing high performers that we had at each clinic, and how to have them work safely together with the providers, with registration, with the nurses to meet the demands of our patients. And then the other part of it that we can talk about too is recruiting more people into that role. And so I was an emergency room nurse and an operating room nurse in my past life prior to coming to Access, and I've worked a lot with TeamSTEPPS. And if anybody that doesn't know, TeamSTEPPS is a framework with teachable skills and competencies that really look to improve communication and teamwork, to improve quality patient care and safe patient care. And so we were looking at what was going on in our clinic and how to have situational awareness and monitoring to know what's going on around you and to be able to teach that and kind of see that big picture for our staff members and for the providers and the RN team registration, like I said, to know how to help each other out and then to know how we can get through the day. One of the things that, we constantly say is like, our goal is we're going to give the best care to the most patients that need us the most. Mm-hmm. And that's really why we're here. And so how can we know there's going to be barriers? People are going to show up late. There might be no shows. There's going to be urgent walk-ins, a medical emergency, something, right?
Yep.
So how do we just get through these, daily barriers in a sustainable way for the staff and give excellent patient care? And so that's where the TeamSTEPPS work started coming in. Again, we started it in medical, and we used the Department of Defense has a free TeamSTEPPS learnings, and they have one for ambulatory care now. And so we looked at that and figured out how to make it make sense for our teams, knowing the barriers that our team was facing. And so that just kind of launched us into this whole new journey of having this improved teamwork and communication in our medical practice, and seeing that in surveys from our staff and patient survey results, and really thinking like, we might have something here.
Yeah, that is fantastic. When you mentioned that the resources available to do this, I mean, probably the biggest resource it takes is your time to do that, right? But I've always been just so impressed with the free resources out there. They're so detailed and, like you say, customized to the various areas.
Yeah. Don't reinvent the wheel. If somebody else has already done this hard work and they're sharing it with you, how can you customize, individualize it to what's going on?
Yeah, we call that the case method, right? Copy and steal everything, but make it yours and make it better.
Work smarter, not harder.
Don't reinvent the wheel.
Yep. Exactly.
Yeah. But it's amazing that so many amazing proven solutions and tactics are available out there to organizations that never get put into place. And when you do, what happens? Like what's happening now that you've done that? And I mean, it's never done, right? It's not like you've done it and you check the box and it's over. But where are you at right now, and what kind of results and progress are you making with this?
So we are fully staffed in both of our medical clinics, both with our support staff, with MCAs, those are our clinical aides, and then the certified medical assistants and the licensed practical nurses, as well as our triage team and with our registered nurses. We have had, it's above a 90% retention rate for all of the teams over the past probably 3 years. And continuing to look at how we're recruiting, one, in not just skill and experience. I think that's what a lot of organizations do, but also recruiting with behavioral and cultural standards, and really looking at that, knowing where our team is, knowing what our team is facing and who's going to fit well into that team, to help continue our retention rate and being able to bring exceptional team members and that are going to fit with what we're doing at Access, how we like to have direct communication, how, we want to take care of our patients and each other, and knowing, that we all are here for the same reason.
Mm-hmm. I love that, being able to be selective about hiring, not just, like a Bright licensed is good enough, right? That's just not good enough for your mission.
And so we did a lot with behavioral based interviewing. It's a different type of interviewing than just go and sell yourself. It's really about how did you react in a situation and what was the result of it and what did you learn from it, and asking questions in the interviewing process by looking at our mission and our behavioral standards and how they would have reacted in a situation when they're faced with something related to that. And that has been extremely helpful. And that's where I would say, recruiting is the first step. And our human resources talent acquisition manager did a lot of training with our managers, our frontline managers, both medical and dental. Obviously, I'm more on the medical side, and really making sure that we're following that behavioral based interviewing to ensure that we're looking for, who's a culture fit, who's a behavior fit for your team. We want somebody that's good, and has that skill. And
I'm an and person. I want it all, right? I want great skill and background and experience and great behaviors and commitment to the mission and all of that. Yeah. Why can't we have it all, right?
You should have it. Yes. Yeah. The whole shebang.
The whole thing. Yeah. One of the things that I know when I was a leader and I first learned to do behavior-based interviewing, it was a difference. It was a very different approach, but wow, I love how you said that recruitment effort and finding that right person, that's the first step in retention and in engagement, right? Is, you're getting them engaged in the organization just through the kind of questions you ask. You're already starting to plant the seeds about what's important. If you're asking them questions about service excellence and being a great team member and safety, now they're like, ooh, this organization has these high standards. And do I want to be part of that?
Yep.
Yeah.
And I would say to Sue, some, individuals that are coming in, especially, our frontline registration and call center staff, where clinical aides, where this might be one of their first professional jobs coming out of high school, and, and they're young and don't have that experience. And so, we found that giving TeamSTEPPS during our new employee orientation process, just kind of a snippet of it. You're going to hear these words. Just know that you're going to hear these on the floor with great situational awareness, great task assistance. We're going to have a shared mental model, all the buzzwords, in TeamSTEPPS, and letting the new team members know that they're going to hear that. And then putting them into a more extensive TeamSTEPPS trainings that we have broken out into part 1 and 2, because we've noticed, and especially as we were down so much in medical, that we had to, as we're continuing to recruit, every time you bring somebody on, it resets the team.
Oh, yeah.
And so doing the TeamSTEPPS part 1 and 2 with the new team members, and then we do quarterly trainings with everybody to continue that cohesiveness and know what those expectations are. And especially with like the kind of the new employee population that I was talking about, it really does show how, when we're communicating about something, great feedback, whether it's, awesome, positive feedback, constructive feedback, it's really, the communication is about, we care about you, we care about each other, we care about our patients enough that we want to have these conversations with each other, because we want to make sure that we are, again, improving patients' health and serving, our patients to the best of our ability. It's not finger pointing. It's not about you. It's about how are we going to do this?
Adult, mature conversations, aren't they?
Yep. We love our tagline is feedback is a gift. And it's a gift that I'm going to give to you because I care about you and I care about our organization and the community that we serve.
Yeah, in capstone language, we call that I notice equals I care. I care enough to notice these
Hmm.
things that I can talk about with you that either recognize that I notice you're making progress, that you're doing it our standard way, and that can be reinforced, or even giving you that feedback to call you out to say, hey, that isn't in accordance with standards, but that is an act of caring for sure. For
Yep.
sure.
Yep.
Mature
Absolutely.
caring.
Yes. Yes. Well, and
Yeah.
we talk a lot with, especially with the new employees, and if something comes up in the clinic, about if you don't have the conversation and you avoid each other, whether it's to because you're going to preserve the relationship and you're really not because you're not having these
Mm-mm.
conversations with each other, you start to tell your own story and you start to build that animosity. And then it's like, see, they always do that. See, they don't care about me. See,
Yeah.
and you find
Yeah.
your biases come in and you
Yeah.
start
Yeah.
to prove to yourself. And then interpersonal conflict arises. It could have been a quick conversation. That didn't feel good.
Mm-hmm.
Tell me about how you
Mm-hmm.
felt with during that situation, as opposed to, knocking on your manager's office and all of a sudden it's a thing and human resources is involved, et cetera, et cetera.
So it is a proactive thing to just have a culture of feedback and,
Yep.
yeah, be willing to give and receive it. And that's a form of investment too, is to give somebody feedback, to take the time and energy to do that and muster the will to do it. But when you're talking about that orientation and the part one, part two, and the quarterly and this and that, like, what an amazing investment, Julia, that you are making. And you mentioned a lot of these people, they're, first time in a professional job. What a gift for their career to
Yes.
have this investment in them from Access Community Health Centers when they sign on as, one of your support staff. I think that's just a gift right there, Julia.
We talk about this during the trainings too, of like, there's so much that we're going to train on and talk about and continue to coach on. I do it in my personal life. I do it with my husband. I do it with my daughter, right? Like it is all encompassing and transferable to many situations.
It's, yeah, good in life too, isn't it?
Yep.
Yeah, and we kind of use this definition on the podcast of culture, that we say culture is really, this is how we do things around here. And so, and it's really getting consistent with, this is our consistent investment in our new people. This is our consistent process for hiring, onboarding, continually developing. We use this model, having a standard way. And really, you're describing a really important part of your culture also in feedback. So, TeamSTEPPS becomes part of your culture, your onboarding and hiring becomes part of your culture. All of this is defining, this is how we do it around here. And then you're actually doing it.
Yep. And speaking of our onboarding, that was another piece that we worked on quite a bit, where both medical and dental did onboarding differently. Onboarding could be different depending on who your manager was, and that doesn't feel good. And so we had two consultants in medical. One was a high performing RN and another high performing support staff move into these roles and create standard onboarding. So we have our new employee orientation and then this other part of it that's our onboarding part. And it's very transparent. It shows the phases and what you need to do to be able to move through the phases and know that you're moving along in your onboarding and knowing that you're succeeding or there's still areas for development. And then the consultants will work with that employee's manager and discuss kind of what's going on and what they're seeing. And then during check-ins, 30, 60, 90-day conversations, the manager is in this constant feedback loop with the employee. So nothing's a surprise. And we're working together to figure out what resources we need to support them to make sure they're successful because we're invested in this. I know the
Mm-hmm.
employee is, and so are we.
Yeah, what a great first impression, too, to new people is even that recruitment process and interview process is kind of your first impression to the candidate.
Mhm.
But even that onboarding part is, as well, as they're like, I made a good choice to come here to say yes to this opportunity. And that's what that's what we want, is them to be really engaged right from that early point to say, I'm part of this now and I'm
Mm-hmm.
engaged and I made a great choice to join Access Community Health Centers.
Yes, yes. Honestly, I'm very excited this week because we had two employees that are affecting our retention rate because they're in graduate school and went abroad for the summer to study abroad at different locations around the world. I want to say it was Spain and Mexico, I believe. Anyway, they both contacted us and were like, we are back for both of them. They don't even, know each other outside of work. They're not friends outside of
Mm-hmm.
out of Access and lead separate lives. And were both contacted us and said, we're back for the semester. Can we come back and work for you again? And
Yep.
that's great.
Yes.
That is what we want.
Yeah, absolutely. Absolutely. When I was talking to some of your leaders yesterday on a separate call related to leadership development, one of the things they mentioned is this goal that the organization has. You mentioned it, best care for the most people who need it the most. So, really about, the more encounters, patient encounters your organization can have, that means, the more of your mission you're fulfilling, right? The more encounters you have is serving more people. And that requires you to have the capacity. And it's not about just having the space of rooms. Probably the biggest thing you need is having the providers and the support staff to do that. So, I suppose you're better set up for success for not only the best care part, but the more care part, being able to meet more patient needs and see more patients, more encounters. Have your volumes gone up because, your staffing has improved, or you've been able to recruit and retain better?
So yes, and our encounters we have a certain number of encounters all providers have to meet. We do see providers go over those encounters, especially when you see walk-ins and how the team comes together to figure out what the patient needs are, and being able to a provider to then easily add them on because support staff got them in a room and started the conversation, and then a nurse went in and was able to do an even bigger assessment and then give to the provider this pretty little package. Maybe the patient's already gone to lab because the nurse used the delegation protocols, and the provider needs to go in and assess, do an assessment to give their diagnoses and give their plan of care and prescribe, whatever it may be.
Mm-hmm.
And so that's made it easier for providers to be able to add on. The other thing we've done is look at different career pathways for all of our staff. And so we have staff that have gone into, we call it the primary role, is what every employee comes in at, and then a senior, and then to a specialist. We have different not everybody can be a specialist, but everybody can be a senior.
Mm-hmm.
And then a specialist role is really an extension, of leadership. They're experts in their field, their clinical expertise is spot on, and they literally do give, the best care to the patients that need us the most. One of those roles has morphed into a population health role, both in nursing and in support staff. What we've been able to do to help with our capacity and to see more patients is transfer some blood pressure follow-ups that mainly a provider would see, tinker, titrate a medication, come back in a few weeks, let's check it again, see what we need to do. And now those patients are able to meet with a support staff specialist who spends 40 minutes with the patient, gets them hooked up with a home blood pressure monitor. We have a program where we could lend it out. Otherwise, we can, have been able to figure out DME or pharmacy, et cetera.
Mm-hmm.
And taking patients that would have been on the provider schedule, they are able to see our population health specialist, do home blood pressure monitoring at home, and have a quick, easy telemed with our providers. And we have had, I want to say, don't quote me on the exact numbers, but the majority of patients, I want to say 70-ish, now have stable blood pressure, and their blood pressure is under control. It's at this point, and we've only been doing it for 6 months, I believe. We started February.
Yeah, goosebumps over that one. Like, what a great example of the team coming together
Mm-hmm.
and serving patients in better ways through a team. And I
Yes,
love the idea of that almost like career ladder or ladder for
exactly.
the staff to feel like they're growing and developing in their role over time and that they see what could be next for them versus just seeing another shift, another day, another week,
Yep.
another year, but seeing how they can have a career of this versus just a job of this. Yeah, that's beautiful, Julia.
The kind of the developing, as you were saying, into like the different roles as you move from primary to senior or senior to specialist, building off of that, our human resources team has been instrumental in creating different competencies for each level and having to, meet our stewardship competency as a primary. Then you have to start meeting what that competency means as a senior. What does it mean as a specialist? What does it mean as a manager, a director, et cetera, et cetera? And so being able to look at that and working with the employees for that. And obviously, we're working a lot with the teamwork and communication competencies are extremely important to us right now as we're continuing to build and benefit from everything we're doing. But where are the gaps and where
Mm-hmm.
can we not say as a manager and employee that sit down together and talk about where they're at with these different competencies if they can't come up with how the situation and how they acted and how they responded, then we might not be meeting it. And what do we need to do to help you get there? Is it we
Mm-hmm.
need to give you more resources in direct communication and feedback? Or is it that we need to do more to help see the big picture and how everything is affected within the clinic, et cetera? And it's been very successful. I actually have a clinical manager in medical now who a few years ago was a primary support staff and then moved into the senior support staff role and then moved into the specialist support staff role and was able to have the confidence, have the growth to be able to become a manager. And now
Nice.
she's leading a team.
Yeah. And I know you invest in your managers too. So you
Yep.
invest in your staff to be the very best in whatever their roles are and to now even be able to advance to more responsibilities or different ones and then also into leadership, which isn't for everyone, right?
No.
Even some of our best techs and whatever, that's their thing. It's not leadership, but it's nice to recognize leadership and people desiring to move into that because we need great leaders too. It's really an important part of the whole team is
Yep.
is the leadership. I was also thinking, Julia, when you were mentioning about, the example of the blood pressure and the population health and how you've organized the team differently and how that saves time and even being able to add more patients into your day to serve because your support staff of, whether it's a medical assistant or the aide or the RN or whatever can both, help to save time for the physician or provider. But, I was really thinking about, I'm sure when, you look back a few years ago when you were very short staffed and in crisis in the support roles, then your RNs and your providers aren't working at top of license, right? They have to do those roles. They have to take those actions that others could be trained and competent and within their scope of practice to do. They're doing them themselves. So they honestly can't see as many patients. They can't serve at top of license and really practice that highest level. And so creating that team that really defines what that is and I don't want to say protects the time of the providers, but really focuses their time on the highest value they can add.
It's really the getting the right work to the right people is, how I always talk about it. Like, what
Mm-hmm.
is the clinical work? And within that clinical work, who does it make sense to do? And if it's non-clinical, can our registration team help? Can our,
Yeah.
who is it that could help that could do the work that doesn't need a license or doesn't need a certification
Mm.
but absolutely. And we did. And you're right. We had to shift so much over to the providers. I mean, to the extent that they were calling patients and they were the first call to their own patient about results and result follow-up when a
Yeah.
complex result follow-up is a nursing job and
Yeah. Yeah.
managing that. And so, and then we started to shift things back and we would kind of look at what's the body of work and how can we start moving things in the right direction again. And we've been pretty steady in that now for, I would say, 18 months or so. And now we're looking at, what are the best practices and how are we streamlining and being able to look at, our current workflows and just continuing to improve them. Mm-hmm. So it was, interesting as you see it when you go from crisis mode, paradigm shift, back to traditional, and how can we improve and how can we excel even more? And because we're out of the crisis mode, and it feels so much better.
Oh, I know. I had those moments in my career too. And it is nice to get to the other side of it. And, I was thinking too is for sure, I can imagine that the ripple effect of getting fully staffed and having such highly engaged and contributing support staff has to have a positive ripple effect on the recruitment, retention, and satisfaction of your licensed, nursing and provider staff. It just has to.
It does. And knowing that it's our own teams that are doing the recruitment for us, it's a joy. Whether your providers do it, the nurses, the support staff, registration, it's really great. And it's just the best feeling to know that it's your own employees that are speaking so highly of what you've created and the culture that is Access and how we work together.
Mm-hmm. I know my husband is a primary care physician, family practice, 42 years now. And I know how much he values his support staff, and
I bet.
Especially his primary medical assistant that works. I mean, she's basically part of the family. She's, she's really that important to his life and his work. Yep. She adds a lot to that and to the patients. So very, very important. So as we get ready to wrap up here in this conversation that just flew by, I know, I'm wondering, is there any hints as to anything big coming up next or any words of wisdom or advice to any other clinics out there? Anything you want to add just as a parting comment?
Yes. So, and, we kind of talked about this, but just doing that multifaceted approach of you need to have good recruitment and we benefit very much from that behavioral-based interviewing, the onboarding and orientation, and then into ongoing career pathways, TeamSTEPPS with the teamwork and communication, and being able to have just direct conversations with employees and the grateful leadership that we learn, from you all of doing the roundings and just creating that inclusive environment is what's been the key to our success. And we're still learning and polishing and adjusting. It's like we said in the very beginning, it's never done. And knowing that it's some of our employees that are giving the feedback about the different education and resources and support that we give has been really instrumental as well. And listening to them and helping them drive what the issues are and what's practical and how do we apply all of these skills into that practical application to benefit the team.
I would say that you guys are truly a model for federally qualified health centers. I really do.
You.
Like, I'm not just saying that. Like, I think you guys are doing so many things right there. And I also love your attitude and commitment to we're not declaring victory. We are just always in improvement and growth mode, always. We're not just standing still and just, relishing in the fact that we've come over a crisis. We are still getting better and still growing. I love that about you guys. I do. Thank you for your time. Thank you for encouraging and sharing with our audience. I'm sure that there's going to be a lot of people out there that are going to go find those TeamSTEPPS resources for sure, if nothing else.
I recommend it. You have my recommendation.
Yes. It's awesome. So, well, thank you, Julia. Very much appreciated. You're welcome.
Thanks for tuning in to Culture Change RX. If you found value in today's episode and you are a believer in fostering change in healthcare, join us in making a difference. Follow, rate, and review our podcast on your favorite platform. Share it with colleagues and your network. Together, we can make a lasting impact. Until next week, keep inspiring positive change.